Hello, my esteemed viewers. Washing of the vagina has been a common practice by most women. Most women believe that when they practice vaginal douching, it will help to keep their vagina clean, it will prevent vaginal odor. To some, it will prevent pregnancy and sexually transmitted infection. The question you must ask yourself is it true that vaginal washing or douching will help to solve health problems? We will find out that in today's discussion. My name is Dr. Godwin Obono. You're welcome to this channel, Medical Science Lecture Room. In case you're new to this channel, please subscribe. Turn on your notification bell so that once new videos are made, you'll be first to notified. Also like and share the Vaginal douching is a practice or a process of intravaginal cleansing by the use of liquid solution such as water, vinegar, iodine, and so on. Many women believe that when they wash their vagina, they are keeping it clean, and at the same time it will help them not to contact any infection, and it will also prevent vaginal odor. The question is, are all these beliefs true? The answer is certainly no. It is not correct that vaginal douching solves all these problems. Rather, it puts the woman at risk of many health or clinical conditions that you will find out soon. But before then, I would like to tell my viewers that when we douche or when you clean the vagina, you may upset the ecosystem of the vagina. The vagina itself has what we call vaginal flora. These are called lactobacillus. These are organisms that tries to protect and keep the vagina free of any infection. These organisms, what they do is they try to keep the vaginal acidic environment between 3.5 and 4.5. This is a pH at which the harmful organisms cannot penetrate the vagina to cause infection, and it's a pH that will also sustain the good or beneficial bacteria. Therefore, at any point in time, there is a balance between good beneficial organisms and harmful organisms. When this balance is upset, either by douching, because when you douche, what happens is that you may decrease, the practice may kill or may destroy some of the lactobacillus, and when these organisms level or quantity are decreased, you will now have the pH of the vagina raised towards an alkaline pH, and that alkaline pH will therefore favor the growth of harmful organisms. So you find bacteria from other parts of the body moving to the vagina to colonize the vagina, and when that happens, the woman is at risk of infection, is at risk of a lot of things, a lot of clinical conditions. According to the United States Society of Obstetrics and Gynecology, they've advised against vaginal douching because a woman who douches because vaginal douching will predispose the woman at a risk of the following condition. That woman may likely have dry vagina because douching will remove the natural mucus of the vagina, and so for such women, they will experience dryness of their vagina. Also, such women may experience what we call bacterial vaginosis. Bacterial vaginosis simply refers to inflammation of the vagina, and this is as a result of that imbalance between the protective bacteria and the harmful organisms. And so what you see is bacteria from other parts of the body will now migrate or spread to the vagina and then cause inflammation of the vagina, and that's the condition we call bacterial vaginosis. That woman who douches, a woman who regularly washes her vagina will expose or may stand a risk of bacterial vaginosis. Another condition the woman may face or may experience is yeast infection. The commonest example is the candidiasis. Another is a sexually transmitted infection. Notable example is the chlamydia and gonorrhea. These organisms normally, when they have infected the vagina, they may not present symptoms. The woman may not notice notice that she had this disease. So over time, the organisms that causes gonorrhea and chlamydia, this organism begins to move or spread from the vagina into the cervix, or to the cervix and the uterus proper, and it may even get to the fallopian tube and the ovaries. And when this organism gets to that part, this reproductive areas or organs, it can cause inflammation of these areas, and this is what we call pelvic inflammatory disease, and that will compromise the functionality of these organs, thus predisposing the woman to infertility. It therefore means that a woman who douches is at risk of infertility. The woman is also at risk of ectopic pregnancy. Now, these are some of the clinical conditions that douching can cause. It therefore means that those beliefs that some of the women hold, it's not correct. Rather, the woman may go through all these problems. So it is advisable to avoid that practice. However, the question so many women may ask, how then do we keep the vagina clean? It's important for every woman to understand that the vagina itself has its ability to cleanse itself. It has a cleansing ability. So what it does is, I've explained earlier, that the bacteria, the vaginal flora tries to keep the pH of the vagina between 3.5 to 4.5. That is a defensive pH. So the vagina cleanses itself, and so there is no need for you to try to clean it. However, some doctors or health professionals have agreed to the fact that washing the vagina with normal water, it's enough, or it's not a problem. If you must do that, then avoid using a soap, allowing soap in probably when you are having your bath, you now have soap. Do not allow soap to get into the vagina. So you can clean your vulva. One, of course, there's just no way we can prevent the soap from getting to the vulva. Vulva is the external part of, or a part of the external genitalia. So where the soap can get to that part, and then you rinse it during when you're having your bed, but do not allow the soap to get into the vagina. So if you must wash your vagina, you can do so with normal water, warm water. But remember, even if you do not do that, the vagina can cleanse itself. Please, for my viewers, in case you wash your vagina with normal water and at any point in time you experience or you begin to notice that the vagina has a foul smelling, the vagina is foul smelling, immediately please report or see a doctor. If you notice that the vagina has discharge, there is vaginal discharge, Though it may or may not be foul smelling, but the color has changed, please see a doctor. Again, if you experience pain during urination or after sex, it may be a pointer that there is also an infective process. So you need to see a doctor. So anytime you see a change within the vagina, sometimes you see redness of the vagina or swelling. When you notice as a woman in either of these, please do not believe that your normal watching of the vagina will take care of it. No, absolutely not. So you need to see a doctor so that urgent measures can be taken to protect the vagina for you. So, in summary, vaginal douching do not have beneficial effect as so many women thought of. It rather predisposes the woman to several clinical conditions. It is important for women not to engage in this practice. Please, if you have any question, drop your comment at the comment section. Subscribe to this channel. Turn on your notification bell so that when new videos are made, you'll be first to be notified.